don't really have time to take up one or two scenarios. The coach shows an opportunity in your group to generate some personal insights and some collective learning around what good looks like and what ineffective looks like in those situations. But I do need at least one volunteer to share their scenario, what they were working on, and what the group responded to. So, who would like to share? Okay.
So our scenario is with the students working in team assignment, and the group presents, and when the member is inconspicuous, allow others to speak for her, and when you pose questions to her directly, she appears hesitant to speak and looks up to her colleagues for support, and when you continue to press on, she starts to cry. What we thought the openly aggressive type of instructor would be just simply telling the student to stop crying and not really be considerate of what's going on with the underlying reason. Passive person is probably ignore the problem, hope it goes away. Concealed aggressive would be not doing anything amidst the class, but then talking to your colleagues about the student, so poking fun about the student. The ideal sort of instructor would perhaps ask the student to step outside just to calm themselves down, speak to the student after the class to discover the underlying cause, maybe they're just having a bad day or something wrong with the family, and but then also debriefing the class at some point about how to handle stressful situations, maybe what's the most ideal, and so, because I think that probably would shock everybody in the class, you just want to make sure everybody's okay afterwards. Yeah.
Thank you. Agree? Push back. Anything people see differently in terms of what the behavioral styles and patterns would look like? Yes?
I think just that the passive approach, the person would take responsibility for making that person, the student cry, and not just ignore it, but also take on some responsibility and feel guilty about doing it.
So it could look like, just hoping it goes away, or smoothing it over, or making it nice, and overly apologizing.
Yeah.
But is it effective action in a situation like that to encourage people to communicate and express their own thoughts and ideas? So how do you not shift into caretaking? So passive behavior can show up in a number of different ways. I really like the way in your assertive response you took account of into account not just the situation and the circumstances, but the time and the place, which is a big part of thoughtful, deliberate choice in how to best manage the situation, and recognize no emotional experience that involves a group of people is isolated in a dynamic between two. Really good response. Okay, time for another scenario. Some of the things they had a challenge with. At the back.
Okay, the scenario is you are having a really stressful week, classroom time, grading assignments, and putting the final touches on a research paper you and another colleague are writing. The commitments at home haven't let up either. One of your students requests a meeting with you outside the usually scheduled time. You graciously agree to meet over your lunch break. He opens the conversation with, "I feel like I need to give you feedback. Most of us are having a hard time with your lack of availability to help us with this part of the program. We think you should know we're frustrated and disappointed. We don't have this experience with other educators." So openly aggressive responses would be, "What is it about independent learning? Don't you understand?" "This is an adult learning institution and you are an adult. Besides, you don't listen in class anyways. And I care because..." "And you're lucky to have me as an educator." Passively, might say, "I'm sorry, I'll see what I can do," but likely nothing will change. Concealed aggressive would be, you'd be nice to them when you speak with them, but maybe on their next test you give them a really low mark. Or you would label them in front of the other staff, have that person labeled. And assertive response would be, "Tell me more, can you give me some examples?" and ensure maybe that the person represents the group as a whole.
Okay, thank you. That was great. Additions or pushback? I know other people were working on it.
We had the same scenario, and we said that a passive person would be very apologetic, and then after the student leaves, they probably criticize or beat themselves up after, and spend even more time that they really don't have trying to figure out how to make up for things or be able to do things better, even if they're already trying to do the best they can. And then for assertive, we said that they would try to problem solve with the student to figure out the best way to accomplish things and make the situation better, and then get the person's perspective and feelings and concerns.
Thank you. Good assertive descriptions. One of them in the moment. And it may very well take you some time and reflection and an opportunity to manage your emotional reaction to get to that collaborative problem solving and constructive action. But it's still assertive if you're building in the time and not shutting off communication.
Me?
Yes. Yes.
It's kind of funny because this exact thing happened to me, and it's been time now, so I've had time to reflect. And as soon as I read it, brought it all back. And I saw
It's amazing
red.
how it rushes forward when the floodgates open.
And I like to think that I'm a, fairly assertive behavior kind of person, but these descriptions of what an assertive behavior should have been, coming from being in that experience, I'm shaking my head and I'm saying, no way, that's impossible. Because this student was wrong. They're plain wrong. You're meeting them on your lunch break, and we all know how scarce lunch breaks can be, right? You're making yourself available. They're wrong. So I cannot fathom a way that you could look this person in the eye, even with time, and say, how are we going to cross over this? How are we going to figure it out?
So in the moment, you may not be able to respond, and you may have to say, I need some time to digest this so you can stay constructive. So again, you're assertive, and you bump into somebody who's wrong, who by any stretch of the imagination is inappropriate in your own expectations. But is someone else being ineffective an excuse for you to be non-assertive?
2 years later, though, and I don't think I was punitive. I don't think that I
Well, tell us what you did, because maybe you were assertive. And
I think I snapped. I think I told the student that they were wrong. I said, no, you're wrong. And I probably said something to the effect of, you're lucky to have me. And I probably said, let's stop with the criticism of me and get on, you're wasting my lunch hour with me.
so,
What's your student issue?
okay, so how many people would justify that response? How many people would rationalize that response, which I describe as rationally lying to ourselves? Is it human? Absolutely. Is it emotionally charged? And were you emotionally charged and your thought patterns and your actions were driven by the emotions that you were absolutely entitled to?
Is it emotional to judge somebody as wrong?
Anytime we move into a place of judgment, so I'm here, and if I'm in a certain place, you're here too. I judge you as less than, wrong. Yeah, it is.
Okay, so when you're judging somebody, is this based
From
on...
my definition and from this model, yeah.
Okay. Even if you have evidence?
So when we move into debating, proving somebody else wrong, demonstrating that we're right, moving into the self-righteous and superior position, where are we operating from? Is it emotionally intelligent? Is it the potential, where's the potential for positive outcomes? Is it a great learning moment that you've capitalized on? Because the person is obviously misguided and needs to learn something, But if you create the opportunity for learning or smash the opportunity for learning. Thank you for being so candid and allowing me to have real life.
Well, I like to think that maybe I'm just having the emotional memory, and I actually perhaps did Midland. Said less
No, that's brilliant, because often when we move away from an emotionally charged situation where we're hijacked and non-assertive, well, we don't know what we said or did. We're cut off from the rational reasoning part of our brain that will allow us to connect. And what we remember often is the feeling of what we wish we did. And when we had impulses to do, we may not actually remember the actual experience. And so, too bad we didn't have cameras or an opportunity to be there.
Yes, that was been interesting.
Thank you so much. That was real. I appreciate that. Okay, I just want to check on the time because there are people who come up and ask for an opportunity for Q&A. So I'm just going to check in with the group. You could do another scenario, or I could open the floor up to questions that you have on the unit that you can ask each other. Where do you want to go? Show of hands, please. Who wants to do another scenario? Who wants to go to Q&A? Okay, the Q&A minutes. But I will stay for a few minutes after the class if anybody wants to just kind of unbundle some of the influence styles. So with that in mind, the floor is open. Questions? And I apologize. I keep walking over here and this table behind.
I just wanted to respond to that scenario because it was very real. But one thing that's happened to me, when automatically when you get criticized or you get, it just blindsides you. Like it would blindside you at lunch to hear this, here you're trying to do everything right, and you get. And what really helped me is the crucial conversations. I can't remember the authors of those, but I've read those books. I do know about crucial conversations. And just to calm myself down in a situation like that, because I work in a very high-powered environment with tons of alpha people. They want to get higher, faster, stronger. They want it very demanding. So you're getting a lot of feedback every day that maybe you don't want to hear. And to calm myself, I would think, these people really, would a reasonable person be doing, sitting down with me and doing this? It takes courage to do this. And that would calm me down to listen and not get into that defensive mode or debate or argue or just, this is totally wrong. And sometimes I would even say, you know what, this is completely blindsided me. I need some time to think about this. Give me your examples. I'm open to hear about it. I need to work with you people. Not you people, that's right. I need to work with you. I want to work with you. I mean, these are my bosses, right? I want to work with you. I trust that you've got my best interests at heart. Like all those kind of things really calm them down too. Because they're charged giving you that feedback, negative feedback, and then you're charged hearing it. So you've got to, how do you calm yourself into that? But those crucial conversations books are really great.
So there's crucial conversations books, crucial conversations, crucial confrontations. They're part of the Stephen Covey series and there are a number of contributing authors. At the London Health Sciences Center at St. Joe's, crucial conversations development is a big part of EI development. Where I love the words that you use, which is blindsided, because that's what happens. When we're blindsided, that's when our amygdala kicks into gear. And you either move into stress or survival response, or our emotionally charged memories overwhelm us, or we move into our patterns of behavior and do what we've always done in those kinds of situations. Or we start out in one influence style, and often when we get feedback that doesn't feel good, it hurts, it impacts us on an emotional level, and we're embarrassed, and that feels awful, so we move into an aggressive influence style to feel more powerful. There's no one pattern of defaulting into non-assertive behavior. The key is to have hindsight. And so you can then recognize what I did there that was less effective, less optimal, less emotionally intelligent. From that place, you can develop insight. But you can't get out of jail until you know you're in it. And so the scenarios are really designed to create those provocative, powerful situations that are familiar enough that you think, oh my God, maybe that wasn't the best way to handle that. Or if I find myself the strategies around that. So their crucial conversations provides a process and almost even a script for responding in difficult situations, and a strategy for developing self-awareness. So it's a good process.
I just guess I have a question. I guess it's kind of about learning how to develop a balance too between, like if you know you're right, right? Like not every answer is there like, okay, yes. Some answers there really are a right or wrong. So I guess it's about still, and I know some of the, when we're evaluating our students, one of the things you evaluate them on is able to maintain a position when conflicting information is presented, if in fact their information is correct, right? So it's not about always, waffling and saying, you're right, what I'm saying, you don't want to be wimpy that way either, because sometimes you're actually right. But I guess it's a matter, for me especially, trying to find a balance between how to be assertive and not be aggressive, even when you know that you're right.
Right. So it isn't about it. So again, please, can I step back here? Assertive isn't about making the other person right and yourself wrong. It's about staying open to learning and discovering what's going on there, so there's a learning moment. Assertiveness isn't about making nice and waffling. That's passive. Assertiveness is open, clear, and direct. Not emotionally dependent on other people to express your point of view, but emotionally independent. Able to honor what you want and need, to ask for it, and to deliver messages about what you don't want and need, but to do it in a way that's constructive and is likely to build a relationship. There's already a strain in those difficult moments. You don't want to fracture the relationship. So how do you deliver the message that, gee, it's really tough to have you come in here on my lunch hour. I'm already stretched to the extremes. I thought I was doing something nice, and now I'm getting feedback that's really uncomfortable and difficult. And it doesn't resonate with me. And then to work it through in a way that either provides time and space that leads to constructive action. So again, it's not about making somebody who feels entitled to put you down that it's okay to do that. Who feels entitled to drop feedback on you that you may not want to accept and pick up. Again, if you're in a certain place, you hear the feedback, you're open to considering it. If it doesn't fit, you don't own it. You let the other person know that and what your perspective is. I don't know. So somebody said you need to quote Dr. Phil, so I'm going to try and do it here. It's not what other people call you that matters, it's what you call yourself. But again, the other piece of the Dr. Phil is you can't change what you don't acknowledge. So how many people in the room had an opportunity to uncover or discover a tendency, a predisposition, or a habit that might get in their way as a clinical educator this morning? And what you can acknowledge, you can change. Time for one more question.
Could you give us some strategies for the concealed aggressive participant when you're trying to maintain assertive?
So, can I just check in? So when you bump in to somebody who's operating with a concealed aggressive style, you shift to an unassertive position. So where do you go? What do you become? Do you become passive-aggressive in turn? Do you become passive? Do you become aggressive? It's helpful to know where your default position is, because you're assertive, you're going to hit these difficult situations, difficult moments, difficult people. It isn't about changing now. It's about what do you need to do to cultivate your capacity to stay in that assertive, effective place. So where do you have a tendency to go?
Passive.
Okay. A real big part of building awareness is uncovering where you have a tendency to go and how that shows up in your behavior. And then you go a little bit deeper to the origin and the source of that behavior. Where did you learn it? Who did you learn it from? When you recognize it's not a part of you, but it's learned, it has less of a hold on you. When you examine it, then you think, okay, I learned it for a reason and it served me at one point in time. Does it still continue to serve me? You do the cost-benefit analysis. If you want to make a change, and I'm not here to suggest that anybody needs to make a change, but someone discovers something about themselves that they want to change, then if they don't want to stay in awareness health, they need to move into action. And the actions are selecting what you're going to do differently, trialing those new behaviors, Moving into the place of clumsiness and uncomfortableness outside your comfort zone that has you building new mental maps, new neural pathways, and new tendencies. You can't eliminate the old habits, you can't eliminate the emotional reaction, you can't eliminate the impulses and the predispositions, but you can create new ways of operating that are more likely to serve you. You can loosen their hold. And anything within your awareness, you can manage. So it's not about ignoring it and pushing it away, it's about servicing and examining it, understanding it so you have insight, and then making conscious and deliberate choices for change. Yes, and then here. I've only got about 5 minutes, so I hope I'm not speeding through.
What you're describing, though, is a process that takes a lot of time and is very emotional and difficult for some people to do. So how do you overcome that fear?
That reluctance? How do you overcome reluctance and resistance and avoidance behavior? You go on your feet and understand the feelings that are driving you, and you manage it. So it's going to be uncomfortable. It's going to take a long time. That's why cutting-edge organizations don't put money into development programs for EI. They put it into their recruitment, selection, and promotion processes. They invest in EI in terms of bringing people in. You want to hire people with this, because this isn't like clinical skills and technical know-how. Those are complex enough. But the acquisition is much easier than it is to overcome the old habits and the difficulties. The reality is, though, I'm working with a room full of people who've managed to be successful. So this isn't remedial EI. This is about, okay, much of the time I'm doing a great job, but if I'm going to get in my own way, when's it going to happen, and with who? And how can I cultivate some capacities to reduce the likelihood of that happening? The emotional brain, emotional learning. Older part of the brain, slow learner. It's best done from a place of support, so that you have a learning partner and that you have the tools and practices that support emotional learning. I brought one of them here, so I hope I have a moment to introduce it, but I do know that there was another question that I think I was just going to.
Well, just really a comment, because as you talk about, how you have to change your behavior. I had a student this past term who had a preceptor in her clinical placement. And the student, in previous clinical experiences throughout her program, according to her, because I didn't know her previously, had what, to all intents and purposes, you would have described as assertive. She was self-confident and did well clinically. And she went into this particular setting, and really what she had was an overtly aggressive preceptor who was a bully and who put her down and let her know what she didn't know. And the student's behavior shifted to being passive. She didn't take initiative, she didn't do all that. And so, of course, then she got worse as far as, just was digging herself in as far as the preceptor was concerned. Preceptor wrote rings on her midterm evaluation. I've never even seen something like this from a preceptor before. Spent a long time talking with this student who talked about how she'd been in previous placements. And we talked about why she wasn't like that now. She went home, had a couple of days off, and came back and decided that she would be her old self that she had been in previous placements. And by noon, the preceptor was saying, holy cow, that's really good. I mean, just changed the dynamics incredibly, very powerful. And she didn't give any feedback to the, I wish you would be more, understanding or something like that. She just changed her own behavior.
The powerful tool of how you bring yourself to the situation. I love the part, there's a lot of richness to your story. The first piece is we can be assertive, we bump into a place where we're emotionally triggered, and we transfer something of our early learning onto that situation, and there's an overreaction and a shift in our style. Really important to uncover what that was about, or to have a clear intention of changing back and knowing what good looks like and holding yourself in that place. And does it change the people around you? Absolutely, it has the potential to. It may not, but it's certainly a position of power that she was operating. Thank you. Okay.
Leanne, can we squeeze
One
one more in?
question.
Can you contrast the difference between managing your emotions versus controlling your emotions to the point where you're emotional neutral or you've surrounded yourself with Teflon? Because we as human beings rely intuitively on a lot of verbal and nonverbal behaviors. And if you're not getting any signals at all because this person is an emotional intelligence queen and they're controlling their emotions, then the interaction and the feedback just isn't there.
Right. I wouldn't call them an emotional intelligence queen. I don't know any EI queens, but I do know that when you're managing your emotions, you're in touch with them. You're reading your internal environment. That allows you to be able to look up and look out and read the environment around you. If you're not reading your own emotions, if you're stuffing them down and suppressing them and repressing them and pushing them away, it's unlikely that you'll be tuned into other people's emotional experience as well. So one way to recognize it is a level of connection and attunement that was there. And that underreaction of emotion is an emotional hijack. The feelings come forward, I can't manage them, I have to shut them down. So it's the freeze response. When we talked about the stress response of fight, flight, freeze, is shutting everything down and disengaging and detaching and moving back from. You move back from your emotions and you move back from the experience. So it's not emotional intelligence at all. So you're distancing yourself, you're disengaging, you're withholding, you're shutting off yourself, you've got the guard. What style is that? Okay. They're not saying anything. Distancing, disengaging, pulling back from people. Does it show consideration for other people? No. Passive is your needs matter more than mine. I'm down here. Depending on the behaviors, it would be either openly aggressive or concealed aggressive, depending whether it was silence or that shunning, demeaning silence. But when there's a lack of consideration for other people, a tuning them out or a lack of connection, you moved into either the concealed or the openly aggressive influence status. Did that answer your question? All right. So the ice queen is never the EI queen. Caring and compassion doesn't mean EI, but attunement and connection means EI. All right, thank you. You've been a great group. There's one tool that's in your handout, and here, that I just want to give you a brief orientation to, and I'm sorry for cutting in on your lunchtime. Mental rehearsal combined with reflection is one of the most powerful tools for cultivating EI. So this is the tool. There's a number of tools that we use in our coaching, but to leave you with something that you can pick up and use tomorrow is really, now that you can differentiate between assertive and non-assertive behavior, really easy for you to reflect on that. Reflect on situations that didn't go well. What non-assertive pattern of behavior emerged for you? What you said and what you did. What you felt. Mental rehearsal is managing yourself doing it assertively. All of you know what assertive looks like now. So insert yourself into that position of operating from that assertive influence out. Imagine the words that you would use. Imagine the management that you would do of your internal emotional experience, but still staying connected. Think about what the other person would likely do. Play out the scenario as if it was happening around you right now, and then capture that behavior. Being able to differentiate between assertive and non-assertive behavior, self-awareness. Being able to imagine yourself operating assertively is both self-management and relationship management. And anything you can envision, you create a new mental map for, increase the likelihood that you'll be able to do it differently the next time. Emotional intelligence requires that openness to learning about yourself, and usually from your mistakes. And envisioning yourself doing it differently the next time. So, thank you very much. You've been great and candid, and I hope you have a wonderful afternoon experience. It sounds like it's going to be very very exciting and challenging. Thank you.
So on behalf of the committee, thanks to Lianne. I think I can tell from the attention and the engagement in the room that it's been thought-provoking and provocative. And I'm hoping you've all gone away with something you can implement tomorrow with your administrators and your colleagues and your students as well. I know I always get some good tidbits. I've heard this conversation now with Lianne and I with her cohort, Rebecca Parks, before, and I always leave knowing that I revert to passive and knowing that I need to do better things with that, with that knowledge. So thanks again for the really good information that we got today, the really practical information and the really applicable information. And thanks so much, and we hope to see you again.